today we are going to discuss one more important topic in pediatric dentistry, that is development of occlusion. So, the word occlusion derived from the Latin word occlusio, and whenever you start with a topic, you should know the definition of that. So, what do you mean by the definition of occlusion? In Dental Dictionary by Mosby, he defines occlusion as a static morphological tooth contact relationship. So, all the tooth which is in contact relationship is called as occlusion. Or we can put it in another way by Ash and Rutherford, that occlusion may be defined as a contact relationship of the teeth in function or parafunction. So, whether the teeth is in function or in parafunction, the way the tooth are in contact relationship, that is called as occlusion. So, there are lot of definitions according to Angle. He defines occlusion as the normal relationship of the occlusal inclined planes of the teeth, which when the jaws are closed. So that is another version that is given by an Angle. So out of this, if you know one or two definitions, that is well and good. So my question is, why are you learning about the occlusion? Why we should learn about occlusion? Why we should know about this occlusion? So occlusion from birth till adult stage is a dynamic state. Okay, so there will be a lot of changes that happens. There are some modifications that happens. There are some additions of teeth coming. When new tooth comes, how it changes, that you should know. Next is a knowledge of growth and development of the arches that helps to differentiate the abnormal and normal teeth relationship, which helps in diagnosis. So once you know the normal as well as the abnormal changes that occurs in the tooth development, or when the tooth exchange happens, then only you will be able to achieve in a diagnosis. Then, if you know these things, that what are all the normal things, what are the abnormal things, then only you can diagnose. Then if you get a good diagnosis, then only you will plan for a good treatment planning. Then it also helps to undertake preventive or interceptive orthodontics therapy, because if you want to do any preventive or interceptive orthodontic therapy, you should know what is the normal occlusion, at what age this tooth comes, what age that particular tooth exfoliates, all those things you should know. So before we start with the development of occlusion, you should know the different stages of development of a tooth. So there is something called as initiation, that is the bud stage. Then there is something called as proliferative stage, that is called as a cap stage. Then morphodifferentiation is there is a bell stage. Then the calcification happens. Then only the emergence, or then only the tooth will start emerging into the oral cavity. So I'll be just giving an insight on development of teeth. I won't be going in detail about that. So when it comes to the development of the teeth, the tooth development starts from 5 to 6 weeks intrauterine. So as the embryo develops, by 5th or 6th week of intrauterine life, the tooth development starts. So it starts developing from a band of epithelium that invades the underlying ectomesenchyme along the arches of the dental arches, that is called as lamina dura. So from the lamina dura, the tooth will start developing. So the lamina dura serves as a primordium for the ectodermal portion of the teeth to develop. So it acts as a primordium. So from that only the exfoliate, the bud stage will start evolving and all those things. So as the tooth develop, they lose their connection with the dental lamina and breaks up by the mesenchymal invasion. So these are the basic histological part which I am just briefing it. So coming to the stages of tooth development. Basically, there are 4 stages of tooth development, that is bud stage, cap stage, bell stage, and advanced bell stage. So when these are the different stages of pictorial representation of the different stages of the tooth development that you can see over here. So when it comes to the bud stage, so bud stage is the first stage, or I will say it is the first stage of tooth development. So dental lamina shows a specific sites of increased mitotic activity. There will be a little bit of proliferation that happens. So there will be in specific sites, there will be an increased mitotic activity, which produces a knob-like tooth bud that is called as enamel organ. So you can see there will be small formation of a small bud like this. Okay, so there will be a small formation of a bud like this, or some mitotic activity will be there. Okay, so the first bud isn't seen in mandibular, because we all know the mandibular teeth erupts first. So the first bud formation will be in the mandibular anterior region, and that is at the 7th week of intrauterine life. And in 8th week, all the maxillary and mandibular primary tooth buds are present in the fetus. Then enamel organ forms the enamel of the teeth. Enamel organ forms the enamel of the teeth, and lack of initiation or lack of initiation that happens, in such cases, there will be a congenital missing of the teeth. So, if there is any abnormality in initiation, that will lead to an increase in number of teeth. That will end up in the formation of a supernumerary tooth. So, this is the pictorial representation of the bud stage, where you can see the ectoderm, oral ectoderm is this one. Then you can see the dental lamina. This is the dental lamina. Okay, this is the dental lamina. Then you can see an enamel organ here. This is an enamel organ. Then, so here it is the central polyhedral cells, and this is the peripheral columnar cells, and the condensation of ectomesenchyme can be seen here. So this is the in short about bud stage. So going to the next stage, that is a cap stage. So there will be the growth keeping on happening. So as the growth continues, the tooth germ is seen, leading to the formation of a cap-shaped enamel organ characterized by a shallow invasion of the deep surface of the bud. So here, the main things what you can see in cap stage is the 3 distinct layers. You can see there is a outer enamel epithelium, inner enamel epithelium, and stellate reticulum. So the rest, all the things remains the same. Here you can see here, this C is the outer enamel epithelium, this one is the stellate reticulum, and this is the inner enamel epithelium. So these are the changes. I'm now just focusing on the changes that happens from bud stage to cap stage. So next is the bell stage. So in bell stage, again it will undergo morphological as well as the functional changes and acquire an oppositional growth potential. So this is the thing that happens in the bell stage. So here there will be 4 distinct zones or 4 distinct layers will be there. There is the inner enamel epithelium, which has already been present in the cap stage. Then outer enamel epithelium, stratum intermedium, and stellate reticulum. So the new addition that comes in the bell stage is the stratum intermedium. So in bell stage, the peripheral cells of the dental papilla will lead to the odontoblast that forms the dentine, and the dental sacs will form the periodontal ligament cells. So at the end of this stage, there will be a cervical portion of the enamel organ that gives rise to an epithelial root sheet of Hertwig, or we can say it as Hertwig's epithelial root sheet. So in this picture, you can see which is this is the outer enamel epithelium, this is the stellate reticulum, this is the stratum intermedium, and this is the inner enamel epithelium. Now the next stage is the advanced bell stage, where deposition of the matrix of the dental hard tissue in a layer-like pattern and is addictive that happens. So there will be little bit of enamel deposition that happens in the advanced bell stage. So these are the different zones of advanced bell stage. That is again enamel is present here. There will be formation of enamel. The little bit of formation of addition of enamel will be there. Then this is the outer enamel epithelium that remains the same. Then this is the stratum stellate reticulum. Then there will be little bit of dentine formation would have started already. Then the differentiation of amyloblast would have started in an advanced bell stage. Then Hertwig epithelial root sheet will start becoming prominent in this advanced bell stage. So these are the different zones or different stages of advanced bell stage. So again, this is again a pictorial representation of different stages of tooth development. This is the bud stage. This is again the cap stage, where you can see inward invagination of the bud is happening because of the proliferation. Then enamel organ has formed, and the tooth germ will be forming. Then this is the bell stage, and this is the advanced bell stage. So this is the basics of development of occlusion, which were how the tooth develops and what are the different stages of tooth development. And when it comes, this is again an important question. Sometimes you can get it as 3 marks or 4 marks as a short note. Knowledge stages. So when it comes to you, as a clinician, you need to assess the knowledge stages, and you should come to a conclusion that okay, this much of tooth is developed, and how you can predict the eruption of the teeth.